Yesterday, Alberta officially surpassed the 70% vaccination threshold to trigger stage 3 of Alberta's Open for Summer plan, with 70.2% of eligible Albertans receiving their first vaccine dose. And that means that on July the 1st, on Canada Day, Alberta's public health measures will be lifted and our lives will get back to normal. On Canada Day, virtually all remaining COVID-19 restrictions will be history. No more limits on weddings or funerals. No more bans on indoor social gatherings. No more limits for gyms, sports, and fitness activities. No more capacity limits at restaurants, in retail, or for places of worship. No more advisories against non-essential travel, so long as you observe travel requirements in other jurisdictions. Instead, we'll get back to doing the things that we all love, the things that make summer in Alberta so special. Backyard barbecues, camping with friends, visiting our parents and grandparents, festivals, movies, and concerts, watching the Stampedes and Elks at McMahon and Commonwealth Stadiums with a cold beer in hand, and yes, the Calgary Stampede. And how awesome it'll be that we open up fully on Canada Day. The day we celebrate the freedoms that we all cherish, that we welcome back fully into our lives, all the freedoms that have been limited at times over the past 16 tough months to help save lives. It's July the 1st. I think that Dr. Hinshaw may be making some recommendations for example, limited mask use in certain contexts, like, for example, obviously, long-term care, continuing care settings, hospitals. She may have some other workplaces where that is called for. So she and the Department of Health are working on a package in that respect. But as I say, the main focus will be on those healthcare settings. Apart from that, we would just ask employers right across the economy just to use good common sense. We need to accept the good news about the protective effect of vaccines. We need to accept that science. At the same time, as I said, we would encourage employers to maintain the good habits that we've all developed over the past year and a bit in terms of hand washing, encouraging their employees to stay home if they're feeling sick, where possible, providing them with compensation so they don't lose, because we don't want people coming to work if they're sick, and so we encourage employers to look at supporting employees when they have to stay home, and you know, monitoring people's health and symptoms, encouraging folks to get tested if they are symptomatic. So those are kind of the basic things that we'll be encouraging businesses. But we're not expecting, Tyler, you can supplement this, we're not expecting to be issuing a whole range of specific guidelines for various businesses. This is actually opening up because of the protective power of the vaccines. And, we're going to have a celebration on Canada Day about our new openness and encourage people to get out there and support those small businesses that have been so hard hit in the past 16 months. Do so with confidence. You know, don't live in fear. I know that some people are going to have a hard time getting used to getting back to normal, and some people may have reasons to be precautious if they are immunocompromised, or if for one reason or another they cannot or will not get vaccinated. I can understand those folks may be taking extra personal precautions. That makes sense. But we would just say, look, we paid the price. We paid the high and bitter price of protecting lives in our healthcare system for 16 long months. We now have the way out of this, which is the miracle of modern science of these vaccines. Embrace it. Say yes to the science. These vaccines, once you get like a second dose, particularly of the mRNAs, we're talking 99% protection against severe outcomes. So it doesn't mean 100%. As I've said before, the virus will circulate, variants will emerge, the most contagious variants will become, over time, the dominant variants. People will get infected. Some people will get sick. Regrettably, a few people likely will pass away, as has been the case forever with the flu, with influenza. So, but we don't shut down society to deal with that kind of limited and controllable risk. we manage the risk. The vaccines give us a superpower to manage it. Let's embrace that. So I just encourage people, we've all made sacrifices, but just think about those small businesses who have been, like many of them, shut down for months. So in some cases, I'm thinking of, some of the concert venues, event halls, nightclubs. Some of those businesses have been shut for literally since March 16th of last year. So get out and support those folks. Many of them are on their last legs financially. And by the way, this is not just about 70% first dose coverage. We are leading the country on second dose. We're going to be hitting 25% second dose coverage by the end of this week. I think we'll be pushing 40% second dose full inoculation by around Canada Day. We are further ahead, and 15% of the population has natural immunity from prior infection, which is also pretty powerful. And the numbers keep ticking up. So our point is that we are going to be fully opening on Canada Day at a much higher level of epidemiological protection, of population protection, than anywhere else in the world that has opened up.